What's going on, everyone? Happy Friday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Friday edition of the Pandemic Update for Friday, May 10th, 2024. If you're new to my channel, this is where we do the daily Pandemic Update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of viruses out there, and you need to be informed with what's going on. That's where I come and play. I give you a 15 to 20 minute news update every day on the latest news and data of all the different viruses, including COVID, influenza, and all those other viruses that are a health threat to you. Want to stay informed? Subscribe to my channel down below. Like what you see here? Give it a thumbs up. Want to help keep other people informed? Let's face it, everyone needs to be informed with what's going on. Share this video with anyone you know. And of course, if you have anything to say on anything you see today, or maybe something that's on your mind, leave a comment down below. All right, starting off today, we do have several news stories we're going to take a look at, which does include a poll. And with that poll, I do have a little surprise that I'm going to show you here on camera. If the camera does work, you'll be able to see something that came in the mail today. And then we're going to take a look at some of our daily data and some CDC data. Does appear to be that there's going to be a little bit of a change with some of the data that we look at each week on CDC. Haven't quite had enough time today to read through all of it. I'm going to read through some of it tonight, but we'll take a look at some of those changes today in the CDC data. Of course, new variant data, New Jersey data, New York data, and hopefully some data from California. We'll see. We'll be refreshing that together. So if it did just come in, we'll be looking at it for the first time together. All right, first off, let's read a few news stories and headlines, as we normally like to do. Bird flu, H5N1 explained. However, that's not the part we're going to read in this. I want to read a headline. 70 people in Colorado are being monitored for illness, local officials say. I don't recall if we talked about this or not, but hey, 70 people are being monitored, so we may see some more human cases pop up soon. And I do recognize some states such as Texas are going to make it difficult for us to find the human cases. This is Colorado, but as you know, the other day we talked about Texas, and one of the leaders in Texas was saying, oh, we don't want CDC coming in. We don't want any investigations done. We'll handle it ourselves, blah, blah, blah. Hopefully Colorado does not go that route. It wouldn't surprise me if more than one state starts saying, no, we don't want the CDC coming in. So, yeah, here we go. 70 people being monitored for H5N1 in Colorado. Now, moving on to some good news. I try the best I can to give you a little bit of good news each time. Doesn't always happen. In this case, it does happen. And it comes from West Virginia. Remember we talked about measles, a case, and possible measles exposure? Well, here's the good news. No new measles cases in West Virginia are being reported. Health officials urge public for vigilance and vaccination. So that is good. And moving on to this now, CDC says, speaking of H5N1, we got to go back to that again. CDC says it's launching a public dashboard to track influenza A, which includes H5N1 bird flu in wastewater samples. The wastewater dashboard will go live as early as Friday with data from different parts of the U.S. Now, I have not checked to see if BNO has tweeted that out yet or to see if it is up yet. I will do that tonight, and if it is out, we will try and include it in the Saturday edition of the Pandemic Update. And I do want to read this second tweet from BNO. CDC confirms that spikes of influenza A have been found in wastewater at a small number of locations. The data can't tell us where it's coming from. Birds, cows, farm runoff, humans, etc. So, yeah, and they do say here they're going to tweet out the link when they get it. All right, we have to go internationally for a moment. South Australia has had increasing COVID-19 case numbers for 5 weeks, as tweeted out here by Adrian. And you can see here, take a look at this. You can clearly see it in the chart that the COVID case numbers in South Australia are starting to rise. So that is something that we are going to have to keep an eye on. As you know, we're in spring here in the United States. We're going to enter summer in just about a month. They are in fall. They are about to enter winter. So they are into their fall and winter surge over there right now. All right, I have to show you this. I put out a poll yesterday. Are you concerned masks will become banned in cities and states in the U.S.? And there's a whole slew of comments. There's about 19 different comments here. And some people are worried about it. Well, guess what? We talked about North Carolina yesterday. Here's my opinion about will I still wear mask. Just got this in the mail yesterday. Fresh shipment of mask. Take a look. This is from, see, I don't think you can see it because we're pretty well blurred out, but I got a new box here of 50 masks. It comes from Honeywell. It's called H910 Plus. It's the first time I've used these. For the longest time, I was using Medic Pro, these masks right here, and the reason why I'm not going to be using Medic Pro anymore is I tried to order masks on Medic Pro, and I don't have the website up here. Heck, it may not even work today. The page for their N95 mask was not working. I tried calling their 1-800 number. It said, this number has been discontinued and is no longer in service, so we're going to be using these new Honeywell masks now. And I'm very interested to try them out. I will try them out when I go out into the wild tomorrow. They do actually have a foam piece on them. Take a look at that. You can see that. And if you look real closely on the side, there's 50 of them in here. They actually have a foam piece where we go around the nose for a tight fit. So we'll see how it does me. The reason why I'm sticking with this type, it's very similar to what I was using before. And the Nosh Medic Pro mask did fit me very well. So that's why I want to continue using something similar because it worked for me. Let me know what's been working for you in the world of masks. And of course, are you concerned that masks will become banned in cities and states such as where you may live? Or, we do have people that watch us internationally. Are you concerned it's going to be banned in your country? It could very well happen. It's a real risk that we have to keep an eye out on. And unfortunately, these masks, or I shouldn't say unfortunately, but it's sad that if they do go, because these masks really do help with fire. If you're wearing the right kind of mask, if you're wearing those baggy surgical, or God forbid those cloth masks that are just so loose and don't do anything, yes, that's not going to protect you. High quality N95 or better mask will. Alright, moving on with today's update, we have a lot of stuff to get through. Taking a look at the pollen levels for today, and some good news. 27% of the country is in the medium status today for pollen. That's down slightly, but we do see there is some reds to be found up in Maine, portions of New Hampshire, northwest Vermont like Burlington, upstate New York. And take a look here what's going on in the plains. Yes, the central region. You're into pollen today. You want to be taking your allergy medicine, this stuff right here. Here's my Allegra. I took mine this morning. Take whatever works for you. Allegra works for me. It was suggested to me by my doctor well over a year ago, and I've been taking it. Taking a look at air qualities today, and we have to zoom this out. Obviously, air qualities are not that bad in the Mid-Atlantic. It's a rainy, gloomy day here. We've had showers all day long, and quite frankly, it does not feel like May. It's 50 degrees here in Philadelphia today. Air qualities, they're not bad across much of the United States. These are some of the best air qualities in a while, but again, look here in South Texas. Found out a reason for it. There's wildfires ongoing in portions of Mexico. So anytime the winds come out of the southwest to northeast, when you get that southwest wind coming in, it's going to bring in the smoke with it. And we do see that there are some air qualities issues in Southern California. Alrighty, moving on. Nothing to take a look at today in terms of severe weather. Taking a look at EMS incidents in Philadelphia yesterday. Again, it was over 800. 806 reported yesterday. That's a high number. That's a lot of calls. Right now, there's quite a few calls in Montgomery County. It's 6:22 at night, and by golly, there are 15 active calls right now in Montgomery County, which is a lot. We're seeing cardiac emergency, cardiac arrest in Pottstown, Pennsylvania. Looks like they're being sent into Berks County to help them with a call. So yeah, it's busy right now. Oh, look at this. Fever in Plymouth Township, Montgomery County. And there are calls to be had in Chester County right now. Just a few of them. Heart problems, injured person, couple falls. So yeah, there are active calls right now, and I suspect it's going to be a busy weekend for calls for a lot of places, not just here locally, around the United States. Graduation. I know some colleges, um, I think where was California, canceled graduation for another reason, not COVID related. We won't go there, but for a lot of people, it's graduation this weekend. And who knows? Graduation celebrations, commencements. Now, a lot of them are outdoors, some of them are indoors, and there's graduation parties afterwards. There's some variants going around right now. I mean, be careful. If you're going to be attending a graduation, wear a mask, please, because it's the right thing to do. We're entering in an uncertain period right now with the viruses. Taking a look at Walgreens, 14% positivity rate this week. That's up 1.3% from last week. BioBot, we'll take a look at wastewater data on Sunday. We're not going to take a look at all those wastewater sites today. However, we are going to take a look at one thing here. I did want to show you this. This is part of the new CDC data update, and there was just one red site last week. We're up to 3 this week. Yes, 80 to 100%. I can see one's in Western New York, one's in Missouri. I don't know where the other one is. I haven't had time to look for it, but yeah, we're up to 3 now. That's a 50% increase, it's saying. And not a very big increase in 0 to 19%. That's only up by 3%. That has actually slowed a little bit. So, yeah, things are starting to, I think we've hit bottom. If there's a dropping period, we've hit the bottom of that. Now we're just bouncing off the bottom around the country. Taking a look now at what's going on with this. I have to show this to you. Hospital occupancy. On May 10th, 2024, this page was archived. Yep. So as of right now, this page is not being used. I'll let you know if there's something else that's going on. We'll have to take a look. Maybe there will be another page. Let's see. What's this say? Yep, we still have the CDC hospitalizations tracker page, but again, we can't see the capacity of what's going on in each state, which I think is rather concerning. What's this? I'm seeing this for the first time myself right now, so it looks like, yes, we can still see the national occupancy, but we really can't see. As of May 4th, 74.1% of all beds were being used in the United States. Can we see individual states? Okay, so yes, we still can see individual states. They're just changing things around. They always like to change things around. We don't have anything to talk about on this day in COVID history, but I do want to show you this. Hospital admissions in the past week. Data through May 4th, so this didn't really update all that much. It says May 10th. It's at 5,098. Someone correct me if I'm wrong. That seems very similar to last week's number. But I did want to show you this. Percentage of change in emergency department visits diagnosed as COVID-19 from prior week. Take a look what you got here. Now let's go back to that first map. You're like, oh, well, it's sea of green. CDC always loved to paint a rosy picture. But then you change it to this, and you can see Maine is definitely seeing substantial increase in the number of people coming to the emergency department diagnosed with COVID. Maine, Delaware, Iowa, South Dakota, Montana, and Alaska are all seeing substantial increases. Some places, such as Hawaii and in Oregon, are seeing moderate increases in the number of people showing up at the emergency department becoming diagnosed with COVID. So it is starting to increase in some places, and that is something we do have to concern ourselves with. Let's see, anything else we're going to take a look at here from the new CDC data? No, we do want to see this. Speaking of that, on top of that, epidemic status for COVID. Now they changed this. We don't have it for influenza here anymore on this page, but we can see it for COVID. And take a look here. This is quite the change. It is now likely growing in Maine, New Jersey, Wisconsin, Colorado, Arizona, Nevada, and California. It is definitely growing. It is in the growing status in Oregon, New Mexico, Hawaii, and New York State. Everywhere else, there's a lot of stable and uncertain places. Some states are still likely declining, but there's a lot of stable and uncertain states at this time. That means they could jump to likely growing or start growing in the next week. So, again, we are in uncertain times here. It's uncertain whether or not we're going to see a major wave. I don't think we will. I think we're still just going to go you know, the old bump in the road. But hey, it is starting to be visible in the data, so it's something we have to keep an eye on. And here's one reason why we may not go to a major wave. The new variant update. We really are in variant soup. KP.2. While it did rise this week, it didn't rise by a lot, and there's a reason for that. Let me explain. KP.2 is at 28.2%. The old JN.1, responsible for the winter wave, is at 15.7%, but then you have a JN 1.7 at 13%, JN 1.16 at 10%, JN 1.13.1, 8%, KP 1.1 at 7.1%, JN 1.11 0.1, 5.4%, JN 1.8.1, 4.8%, KQ.1 at 3.8%, JN 1.18 at 2.6%. You get the idea here. There's a lot of different variants, and a lot of these smaller variants did increase a little bit. If they didn't exist, KP.2 would have likely probably been well over 30% at this point. So you can see here, there's several different variants. All right, we mentioned the CDC. See if green a little bit ago? Well, that is the case for influenza. Influenza's not doing bad. It's low across the majority of the country, and in some states, like here, take a look at North Carolina, it is minimal. Still in a low, greenish yellow category for DC. Minimal now in New York City, which really is some good news. And I think pretty soon it'll be completely green in the majority of the country because remember, I don't think this often includes influenza A. Someone told me this does not include influenza A. So if influenza A or H5N1 should start, that's not going to be present here. And again, we will get that influenza new wastewater dashboard when it comes up. We'll include that in the updates. All right, moving on to New Jersey now, where we do have some good news to report. 69 out of 70 hospitals reported today. Hospitalizations have dropped to 147. So New Jersey continues to drop once again. 2 people on a ventilator, 14 people in the ICU, 31 discharges reported in the past 24 hours. New York State, 590 cases. They're holding strong now in between 300 and 650 cases or so a day. So that seems to be about where they're going to bounce around at this point. New York State hospitalizations, let me zoom this in so it's easier for you to see. They did not see a significant rise at all. In fact, I think they dropped a little bit today, didn't they? Let's see here. New York State, yeah, it dropped a little bit. 432 hospitalizations and 29 people in the ICU. All right, drum roll, please. We have to take a look and see what's going on for Los Angeles. And as you can see here, 5-9, this did recently update. Must have came in late last night because we recorded late and it was not in yet. LA, take a look at this. LA is reporting 88 people in the hospital. COVID deaths, they're down ever so slightly. Cases, still dropping ever so slightly, and just a minor increase in the positivity rate. Taking a look at California, this is the page for California. If it does come up, well, doesn't look like it's going to come up. So up, here we go. California, I was just about ready to say, well, we'll take a look at it tomorrow. And we can see here, the positivity rate in the state of California, it's up by 0.7%. COVID deaths are actually up by 0.3% in California. I wish they would tell us the actual number. Maybe they do here. Let's see here. It looks like at the end of April they had a couple COVID deaths here, and now it's saying that there's none. So I don't know why that's saying 0.3% up, because when we click on 5-4, you can see the number there is coming up as a big fat 0. Not sure what that's all about. Influenza positivity rate is down, and influenza deaths are being reported down. But again, that positivity rate in California is starting to go up once again. And if we go back to this, you can see the epidemic status for COVID in California is now likely growing. So there's agreement between the state data and the CDC data for California. Alrighty, folks, we'll have more news stories tomorrow, and we'll take a look at some more data again tomorrow on the Saturday edition of Pandemic Update. If you enjoyed this update, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. We're getting so close to 3,000 subscribers. Let's see if we can hit that by the end of this weekend. Of course, share this with anybody you know, and that's the best way to get us to 3,000 subscribers. The more people that subscribe, the more people I am helping to keep safe. If you got any comments, leave them down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Friday evening, and have a great weekend. Hey, it's Mother's Day weekend. If you don't get a chance to tune in, enjoy your weekend, but do so safely, and remember to mask when out in the public. Thanks for watching. See you again next time.